Welcome to the Confidence Through Health podcast. My name is Jerry Snyder. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. I'd like to thank our sponsor for this episode, All In Health and Wellness. If you're looking for a health coach, you're looking for a sports performance coach, you're looking for nutrition guidance, like for instance, a meal by meal plan that will help you understand how to eat. It will teach you how to eat, and it will give your body, your cells, the proper nutrition to feel great and be able to perform at your best, not just physically, but also emotionally and mentally. If you're looking for those things, you're looking for the key to improve your sports performance, both from a nutrition standpoint and an exercise physical standpoint and a mental standpoint as you approach your athletic event. All In Health and Wellness is able to help in these areas. Go to allinhealthandwellness.com and you'll find the contact information for how to get in touch with them and get started on the plan that will improve your life.
So thank you, Patrick, for being a guest on the Confidence Through Health podcast.
Hey, Jerry, I'm really happy to be here. It's always an honor to be able to kind of talk about health and wellness with guys like yourself, trying to kind of change the landscape. So ready to dive in.
Well, and that's exactly what I'm trying to do is get people to understand that they have some control, right? And as a pharmacist, I'm sure you have seen this, this sort of where people come in and they're just like, oh my gosh, I'm so confused about what's going on because I'm on this, I'm on that. But like before we get into all of that stuff, what was the desire? What led you to be like, okay, this is the career path I want to choose? Like, because I know pharmacy schools, it very competitive.
For sure. So for lack of kind of a better term, it was just like to get into the actual profession of pharmacy. It was just kind of like odd life events. Some people would say, you know, God or the universe or however you believe has like kind of guided me to this. And I used to play college baseball. I was a baseball player pretty much my whole life. And then some of the people that I was playing like men's league with after college and stuff they worked for one of the big box pharmacies. And there at the time there was a shortage of pharmacists, and they kind of said, hey, you should probably look into this. And then I started coaching baseball, and one of my baseball parents was a pharmacist. And a lot of these people who weren't maybe necessarily pharmacists, but they worked in the industry some way or somehow, it just kept coming up.
Yeah.
And to a certain degree, you kind of just have to listen, right?
Right. Yep.
There was other things I think I wanted to do. Maybe I never thought that I would be so engaged in school. I mean, being a college baseball player, you're like, I'm not here to play school. I'm here to do baseball.
Yep.
But then you kind of realize that can end in your early 20s and you have this whole life ahead of you. So that's kind of how I got into pharmacy. I just listened, and it was there. I worked in pathology and kind of toe dipped in medicine there, and had some really great resources and people for the company I was working for. And even our medical director, who was like, dude, go to pharmacy school. So like everybody was kind of pushing me to do this. And so that's kind of why I landed there. As far as being a healthcare advocate, I got out of pharmacy school. I practiced for a little bit. I had some grandparents, my two grandparents on my mom's side before pharmacy school, and even into pharmacy school, kind of they had aged and both lived like really full, pretty great lives. I mean, into their 80s and 90s, I would say that's pretty awesome, with minimal health issues up until kind of the last 2 years of each of their life. And noticed that when they were starting to have these health complications, more and more doctors got brought into the fold, more and more medications got brought into the fold, more hospital visits. And you can kind of see how someone can get caught in the hamster wheel. And it happened with my grandparents, and not being trained in medicine or understanding anything, I had to kind of learn really fast to help them.
Yeah.
And then in pharmacy school, I had a better idea for my grandmother. And so got to help her a little bit more, but I mean, she's just wrapped up in it. And then in practice, you notice that these incidents were not in isolation to my family. These incidents are everywhere like many families. And it's not a matter of support or people loving them. It's a matter of knowing the language, understanding the healthcare system,
Right.
and just there's so many moving parts, and even the behind the scenes can get kind of crazy, right? So all of those things are kind of what pushed me to go to pharmacy and then leave that practice and start my own practice of being a healthcare advocate. So where I can monitor people's medications that maybe a pharmacist or another prescriber doesn't have the time to because they have so many different patients and things. So
Right.
I really got to hone in and work one-on-one with patients and families.
Yeah. Well, and that advocacy piece is really huge for people, and that's one of the things that I try to help people understand and promote with them is that like you you don't have to have a medical degree to understand that you still are the number one person that understands your body and what's going on in it. And
Right.
yet you might not be able to read the test results or the MRI or the X-ray, but like you know how you feel. And if it doesn't feel right and it gives you a queasy feeling of like they're telling me something that doesn't jive with, then that second opinion is huge. And if you hear it enough times, sort of like you do with pharmacy school, right? If you hear it enough times, okay, maybe that is what's going on and
Right.
where I need to go. But a lot of times you'll and I saw a stat on this. I want to say it was more than 50% of the time you go to a doctor and you're going to get you're going to get a second opinion. It's going to be different than the first one. And so it's like, okay, well, if you're only taking the first one for what they say, then and it doesn't feel right, it's okay to go back and go like, okay, wait, no, let's go look a little deeper, even though I don't understand the terminology. Like I have to be my own advocate and I have to stand up for myself, or I could just become a part of the system and just get washed away with everything else.
Sure. And those are all really viable. And I would say, I mean, I'm a professional, right? Like
Mhm.
this is my career.
Right.
You can always bring a friend. You can always bring a family member just to have
Right.
some support and backup, right? Like it's hard to deal with something necessarily, especially something difficult or
Mhm.
maybe like lack of, funny pun, a tough pill to swallow, right?
Yeah.
But if you have somebody there that can stand up and ask questions
Mhm.
and kind of stop because and I've seen it in my profession is somebody gets a difficult diagnosis, they're not really in the frame of mind to sit down and ask
Oh
questions
yeah.
or they're getting something completely, you go to a doctor specialist and you get a diagnosis out of the blue because of a blood test or something that you weren't expecting. It's tough to sit there and be able to ask a question and stop them. Most people just say okay and they just take what's given to them. And
Right.
sometimes they're right and sometimes maybe another opinion. And I've seen multiple times in my profession where we seek another opinion for a client and or get another round of testing or whatever the case may be. And
Yeah.
it comes back and it wasn't what was initially thought. And
Yeah.
it's not necessarily the doc. I mean, their training goes through a lot of times diagnosis are made on diagnosis of elimination, or they see the same
Sure.
characteristics popping up with multiple patients, and then they see this patient, the same characteristics have popped up. They have no reason to not think
Yeah.
it's something, right?
Yeah.
So being able to kind of research and ask questions is important. And it's
Yeah.
not just having a professional, but having somebody that you trust and love who trusts and loves you
Mhm.
is able to go to these appointments and help kind of move things along. And
Right.
then maybe you can have lunch afterwards and talk about it and kind of rehash the visit and think, well, maybe something wasn't right here. Or maybe I didn't say that right. And it caused this thought process. So there's definitely ways to take care of your health and a loved one's health just by having somebody there to make them feel more comfortable in this crazy whole process.
Right. And take that emotion out of it,
Sure.
right? Like, because that can drive wrong decisions both on what seems like a positive or a negative, in the moment, decision. You can go way off course just because the way your emotional reaction to the diagnosis is.
Absolutely.
So, like, when we get into navigating that healthcare system from the standpoint of, a lot of people in our country, and really around the world in countries that are more westernized, chronic disease is on the rise. And typically if somebody's got one chronic disease, they're going to wind up with three within a few years after that first diagnosis. simply because of lifestyle and eating habits and things that we know are driving that train that direction. So we wind up with multiple doctors in the picture, right? So we've got our primary care, and then we wind up with a specialist for this or a specialist for that. Or um, once we get into that, that web, like from the most part, like what people I think don't understand is how little those people talk to each other,
Right.
right? It's not like they're all like you go in and you see your primary care get an update. They're asking you for information, like what did that doctor say? Because they don't have a clue because it's
Right.
not shared information, right? And so is that where like we need to not just take that doctor's visit as a like, okay, let me get all this information, but then we've got access to most of us have access to, oh, let me email the doctor and have like, can you put everything back down in writing? Can you just give me a summary of what the diagnosis is so that you've got it in writing? It's not a 3 weeks later, I'm trying to recall everything he said, right?
Yeah, absolutely. So a lot of electronic health records, I mean, every hospital system or doctor's office or any type of place, they all use the electronic health records maybe assigned to them or that
Mm-hmm.
the practice bought into, and they're not always capable of communicating with each other. So that's one. I mean, even though we're on this digital world, EHRs aren't talking to each other. The next
Right.
thing, I deal with this all the time. I don't like it. It's kind of annoying, but it's part of medicine. We still use fax machines. Like
Right.
1986 called guys, they want their fax machines back. We
Right.
have email and way more secure ways of
Mhm.
sending things digitally that, I think HIPAA compliance really, and a fax machine is like the easiest way to break HIPAA, right? Like
Oh
somebody can
yeah.
just walk up to it and take the paper. So it's not like we're
Right.
being compliant here, right? Um, and then on top of that, I mean, you still have offices. Like I went to an appointment this weekend and the office is still on paper. It's 2024, right?
Wow.
We're still on paper. We have a whole office that's all the paper files are behind them.
Wow.
And when they come in to an appointment, they have a paper folder
Mhm.
and it's all paper, paper, paper. And fine, but how are you receiving communications?
Yeah.
And it's just a matter of that, right? And so
Mhm.
sometimes those barriers just make it harder for the patient to, because not, I mean, who has access to a fax machine at home?
Right.
It's not, I mean,
Yeah.
that's not a
It's
thing.
not.
And if
Yeah.
I can't tell you how many offices I've called and they say, no, only fax. We only accept fax.
Wow.
Like, does anybody have an email there? Yeah, but we just accept information through fax. So that makes it harder for the patient to be able to communicate. And so
Right.
then they might have to drive there. And what if they live rurally or whatever? And then they have to drive an hour to their appointment.
Yeah.
So then, and that's a whole bunch of things can happen in that time frame. Just there's so many barriers. I mean, we can just talk about barriers to communication probably for hours,
Right.
but there's just so many barriers to communication. And the problem is when somebody's already feeling sick, feeling tired of feeling sick, they're going to try a couple times and then they're just going to be like, screw it.
Right.
And, and it's just, I mean, that's just the way it is. When you're sick and you're tired of dealing with something, you got to take a rest or a breather. And
Yeah.
then it just goes to the wayside because other things come up.
Yeah.
And that's kind of really some of the things I've noticed with chronic illness is you can only get so much out of them because they're already not feeling great. They also probably have a bunch of medicines to manage. They have other
Mhm.
doctor's appointments to go to. And a lot of these people end up spending most of their time going to doctor's appointments.
Yeah.
It's like doctor, doctor, doctor all the
Mhm.
time. And there's really not a relief. They get tired of it.
Yeah.
And so then at the end of the day, their health gets put on even more of a back burner
Mhm.
because they're just so tired of dealing with the system, or
Yeah.
if their insurance company denies something and that's more paperwork. And it just, everybody's so tied up in bureaucracy and paperwork at all of the times that even the offices, the staff, they don't feel like doing it. So
Yeah.
it's this whole thing that our system has kind of created difficulty to navigate. And that's why a lot of people just really have a tough time. And it's
Yeah.
just all this management of
Right.
everything.
Right. And I mean, it is true. And it's the stress, the extra stress that it puts on you as the patient isn't helpful.
Right.
I mean,
That's like,
that's driving your disease even more.
right. Stress is a killer on its own.
Yeah.
And I mean, heart disease, diabetes, I mean, stress causes inflammation.
Yep.
Maybe stress isn't like the sole contributor to a disease, right?
Right.
but it can definitely worsen it. It can definitely kind of kick somebody over in from being borderline to, full disease.
Yeah.
And so managing the stress is one of the most essential parts to really anything in life, but
Yeah.
especially with healthcare.
Yep. And so for the person out there that, I mean, people that are on medication know this because they hear it from their doctor. Whenever they go into any doctor's visit, bring your list of medications, and I've seen, both family members and other people that I've seen that just carry their Ziploc bag of the whole thing, like everything's coming in, which is of course a pain in the butt. And if you forget one, you don't necessarily know that you forgot it because you just assume I put them all in the bag. They're all here, and God forbid you forgot one and then the doctor doesn't have it on the list. But that's not helpful for the patient. And I'm sure that after doing that all day long, the nurses and people in the clinic are like, God, another bag of medication I got to sift through and list everything out. Which again goes back to the records being correct, but having all those medications in knowing what they are, and not just having them, but also like, are you taking them the correct way?
Right.
Right.
Adherence is
That's a
big.
whole nother piece of the puzzle there. But having that, like I've heard from multiple people, like if once you have that, you go to your doctor, like check back in with your pharmacist, right? And make sure that the pharmacist is looking at it because especially, a primary care doctor is learning and honing in on certain things. And if you're going to an oncologist or a cardiologist or somebody else, and they give you a medication for what they see, the primary care physician may or may not be 100% familiar with that medication, right?
Right. Especially, not to sidetrack, but when you're getting into the world of oncology, that's just a
Yeah,
completely different area of medicine. I mean,
right.
it's very difficult. There's new drugs coming out all the time and it's really
Yeah,
constant. And that's for a lot of fields, but especially
right.
oncology.
Yeah,
That's one of the number one things I see.
yeah,
And this practice, I've been doing this for a little bit now, and I'll see when one of my clients has all my clients have more than one doctor. I mean, that's
right.
kind of like it's not a prerequisite for coming to see me, but it's just like that's when it kind of starts getting um apparent that maybe they need to. So
Yeah.
generally like the primary care should probably be kind of thought of as the quarterback, right? They're
Mhm.
making the referrals. They're saying go
Yeah,
here, go here, go here. It's kind of also tough always to get that information back from those doctors. And they are also partly in charge of finding second opinions and doing things like that.
yeah,
All of that is there's a lot on their plates, and the insurance model, Medicare model, while sometimes is great, also kind of confines them to only a certain period of time that they can really visit with somebody,
right.
which most of those visits are consolidated to like 10 or 15 minutes, 15 on the very
Hmm.
generous side.
Hmm.
And you can't really get a whole lot done in the 15-minute visit. I mean, you
Right.
can have a little bit of a discussion, but for the most part, it's tough. Generally, it
Mhm.
takes like 45 minutes to an hour to really kind of lock everything in. So
Yeah,
that's where having a really effective point of communication comes in, kind of like what we were talking before, past medical history, medication list, just having all the health information organized as best you can.
yeah,
Because if you're going to different appointments, boom, that's information can go out really quickly. It can update, they know it's accurate, and then everybody's kind of on the same page. Take the guesswork out of it,
right.
right? Now, the number one issue I see is if people are coming in with a lot of medications, and let's say in your example, like they forgot one or two, a lot of times the average person has a hard time even pronouncing that medication
Oh,
or
sure.
remembering if they're on multiple. We're starting to get into the 8, 9, 10 plus number of medications,
Hmm.
remembering exactly what each medication in specific indication is for. So
Right.
why it's prescribed. And then another huge issue I see, and this is across the board, I think almost every single time when I start working with somebody new and going to their appointments and kind of starting to manage their health and medications with them, is that if they have generally it's 3 or more doctors, 1 or 2, it's usually pretty close. 3 or more is when you start seeing that the medication list have differences. And it could be 1
Hmm.
or 2 drugs, but those 1 or 2 drugs could make a huge difference in somebody's quality of life. It can
Right.
make a difference if something is prescribed and now there's an interaction or a contraindication indicated medication that the provider didn't know about, and
Yeah.
now there's potential for trouble there. So it's so important to keep those lists updated. And I even print off a little card for a lot of my clients for
Mhm.
them to put in their wallet or their purse so that if they go to the hospital, they pull out the card. It's not as detailed, but it has all the medications and the dosages, and generally like a couple times a day or once a day whenever they take it.
Yeah.
And at least that gives them a peace of mind that when they go to the hospital knows what their home meds are so that those can be either consolidated or restarted for when they leave, and
Yeah.
so that no drug interactions or side effects or contraindications can really come up in the hospital.
Yeah.
And so taking care of that end kind of helps shore up a lot of those issues. And again, it kind of comes back to communication, but
Mhm.
also just taking the time to understand the system.
Right. And that's like that's the beauty of the pharmacist, because like you have to know the drugs, right? Like,
Right.
and I mean, I've done this, picking up medications for my wife for different things, and um where they're like, do you need to, you know, the pharmacist is asking me like, oh, do you need to go through all this stuff on this one? Are you good? You understand how to take it and everything? And I'm like, oh yeah, but no, I'm not worried, because I mean, it's not for me, it's for my wife. You know, um, she got the prescription, she talked to the doctor. I'm assuming she knows all the ins and outs of it. You could tell me, but like, it's not going to be the same as telling her.
Right.
Um, but how many people do that where they're like, oh no, I don't need to know any other information about it. I trust my doctor. He's prescribed it.
Almost all the
Whereas,
time.
but that interaction could also be something that is very vital in triggering one of those. Oh wait, you said don't take this if I'm taking. Well, I'm taking that, right? That could be a very easy, like you said, communication. That could be a very easy communication point that would trigger. Oh hey, wait, doctor, why'd you prescribe this when I'm on this other medication that the
Right.
pharmacist says is going to, cause a problem?
You see some issues too come up where, so let's say somebody has like three doctors right near where they live, but then their fourth doctor is like across town.
Hmm.
There's a chance, I'm not saying it's like a high likelihood, but I see it where the person will visit these doctors and they'll fill at one pharmacy close by, like their home pharmacy. And then this doctor's so far out that getting that prescription, bringing it to the pharmacy or having it sent to the pharmacy and pick it up, sometimes they
Hmm.
just don't. And they'll find another pharmacy that's close to the office so they
Oh,
can
right.
get it all done somewhere else.
Yeah.
So then your home pharmacy might have like 5 out of 6 of your drugs, but then the other pharmacy has the one.
Yeah.
And so that can create a lot of confusion
Hmm.
because now you have one, just kind of one or two outliers at a different pharmacy. And that pharmacy doesn't know maybe that they're taking these other drugs.
Right.
And so there's some issues there. So if you do have two pharmacies, which I recommend against, but I get it. Sometimes for various reasons it happens.
Yeah.
Try to make them both aware of each other and that
Hmm.
you're filling here for whatever reason. And I mean, it just happens. I mean, that's part
Yeah.
of the game.
Yeah.
The other thing is take those times. If you have a question, you can always ask for counseling.
Hmm.
Legally, pharmacists across the United States are required to counsel you if you need it. The pharmacy might be busy, so maybe schedule an appointment. Say, hey, I'm going to come back at 1 o'clock if you have
Right.
time. But take that time because those important aspects of understanding the medications have huge effects down the road,
Yeah.
especially with other prescribers, other medications. And that's really why we want to kind of keep all these lines of communication open. Plus, if someone is filling at the same location and a medication that's contraindicated comes in, they can stop it right there, send it back, and
Right.
tell them. So, a pharmacist, and to think about this is me advocating for my profession, but
Hmm.
we're the last line before somebody gets their medications.
Right.
You're the last line of defense.
Yeah.
And there's a huge opportunity there to A, save someone's life or a hospital visit,
Hmm.
and B, give them the information that they need. Most people come to the pharmacy and they say, can I drink with this? Right? Like this is like
Yeah.
number one question across the board, right?
Yeah.
And that's okay, cool, because a lot of drugs interact with alcohol, but
Right.
there's a lot of medications that interact with food, diseases, and other drugs.
Hmm.
So if there's any question in your mind, or especially if someone gets a brand new prescription that they're unaware of, just ask the pharmacist. And even at a busy pharmacy, they will take time to talk to you. And
Yeah.
I think all my friends that are pharmacists, they love talking to patients about their drugs. I do for
Yeah.
sure.
Yeah.
But it's really an opportunity to highlight our knowledge and our features rather than just sitting there and putting pills in a bottle and sending it out the door,
Right.
right? Like that's
Right.
not really our skill set. It's
Yeah.
part of the job for sure and for a retail pharmacist, but our skill set is so vast. And I just think that a lot of people aren't aware. I mean,
Mhm.
I'm years out of pharmacy school and I've been licensed for a while. And people say, "Oh, you're a pharmacist. You work at big
Right.
box chain," without mentioning any names here.
Yep. Yep.
And that's the question I always get. And I say, "No,
Yeah.
I have my own business. Oh, is that a pharmacy? You give out medications?" No, I help people with the healthcare system. So, but it's just the way that it's just the way the perception is about the
Yeah.
profession, about pharmacists,
Yeah.
that could use a little bit of a shift and realizing that pharmacists are being given across the United States, and depending on the state that they're in, are being given a lot more responsibility.
Hmm.
Our education is 4 years. It's a doctorate program. And when you think about other healthcare professions, they study whatever their scope of practice is. I remember being in pharmacy school and just hours a day is drugs and
Right.
diseases. But that is how much training we get. And it really should show people how intricate medications are.
Hmm.
If there's an entire 4 year program dedicated
Right.
to just learning about drugs, and I mean, we get maybe the top 400 drugs. There's thousands of
Right.
medications out there. I mean, there's no way to even possibly know all of
Mhm.
them sometimes. But it's just so important for people to realize how many medications are out there and how well versed pharmacists are in understanding those medications and the diseases that come along with them. We don't
Right.
diagnose.
Right.
Some states have like test and treat laws where you can do a test that can kind of help push along a diagnosis to get them the medications that they need
Hmm.
for it.
Hmm.
But as far as that goes, we understand if you say a disease state, chances are we know the right drug that goes with it. At least like
Yeah.
first couple lines of
Hmm.
defense, um, depending. So that's really important to know and have a pharmacist watching your back. If
Yeah.
it's your pharmacist at your community or a professional or anything, it's so important. And America is like the most prescribed country in the world. We have drug
Right.
commercials, we have medications all the time. And I feel like a lot of people go to the doctor and generally leave with a prescription sometimes
Yeah.
if something's wrong. So it's really important to kind of be, even if it's something benign or you're on it for a week or two, but a
Hmm.
lot of people leave with medications, and that's just kind of how our health system is. And it's important to know what kind of benefit and what kind of harm are these medications going to have.
Right. And it's a very common, right, to go to the doctor and leave with a prescription. It's almost so common that it's like I expect it, right? Oh, well,
Yeah, consumerism.
yeah, like you leave and you don't have, and you're like, something didn't happen right. I didn't get a prescription. But sometimes that's okay. Like let
Right.
your body heal itself and take care of itself. Um,
I think it was Hippocrates that said sometimes to do nothing is
right?
just as good.
Yep, it's true.
But the problem is a lot of people. I love using the example of the flu because it's
Hmm.
just really easy for most people to understand. In reality, it clears up in 7 to 10 days for a
Right.
somewhat healthy individual, right? Chronic
Yep.
issues and other things maybe a little longer, different. But
Yeah.
you go in for the flu. I feel awful. Chronic, symptoms or classical symptoms. The doc could say, stay hydrated, go home and get plenty of rest. You'll feel better in a few days.
Yeah.
Or they get prescribed, something. But I've heard from a lot of physicians that sometimes patients get mad when they don't get something. They feel
Hmm.
like they were shorted. They spent
Right.
money on a copay. Oh, just for you to tell me to go drink water and
Yeah.
rest, like I could have done that, right? You know what
Right.
I mean?
Right.
And so they don't feel like it's necessarily medical advice. I had a client go to a urologist, and the urologist said, "Dude, you need to drink more water." And that's like exactly his quote.
Yeah.
You need to drink more water." And my client's leaving and he's like, "There's all these medications and all this stuff." And the guy tells me to drink more water. I could have done that. And I was like, "Well, you're not drinking enough water." So maybe you
Right.
had to have somebody tell you.
Yeah.
But those are the type of things. But I see it where people want to leave with something tangible.
Yeah.
And that's maybe how it's been ingrained into our brains. And a lot of docs will say, if I don't give them something, what happens if they go find a new doctor that will?
Yeah.
And then it's sad, but you got overhead, you got to have your
Hmm.
patience. So sometimes
Right.
they do that so that they don't lose a patient. And these are all realistic aspects of our healthcare system
Right.
and things that we have to think about as practicing healthcare professionals. I mean, we've got to keep the doors open, but to what degree does just saying, hey, you'll get better in a few days, I mean,
Yeah.
where does that stop, right?
Right. Well, and when you've got other medications in the already in the pipeline too, like then it becomes. And I remember years ago I went in and was having allergies that turned into a sinus infection, and the doctor was like, well, I mean, like just like you said, he's like, well, based on where you're at, like I could give you a Z-Pack and it could speed things along by a day or two, but basically you're going to feel fine by the end of the week. And I was like, oh, okay, well, I mean, I don't, and basically what we decided was give me the prescription. If I don't feel good enough in 2 days, like I'm over the hump, I'll go get it, help me along. But like otherwise, like, okay, I'll just go along with it and let it take its course. And um, sometimes our body needs that because it boosts our immunity,
Sure.
right? To go through that versus it having the drug help us along. If we do that too many times, then it's almost like our body needs that crutch, right?
Sure.
Like,
And I mean, sometimes those drugs help. Like if you're talking about a respiratory infection, they're going to help kill
right,
the bacteria or the virus that's causing it
right,
so that our body's able to kind of now our immune system can take over and kind of push through where
yeah,
it's maybe a stalemate going on in there, right?
right, right. And but that's where it's like when it comes to chronic diseases, if you've got multiple things going on, having and you get the flu or sinus infection or something that for most people would be just okay, you have the option of resting it out. But for somebody with something that's chronic and it's like, okay, your immune system is already overwhelmed, go add this additional, even though it's a temporary medication, add this additional medication to it. That can also be sometimes it's so just easily thought like, oh no, everybody handles this. It's no big deal. But check with your pharmacist because a lot of times there's like, oh, I forgot he's on this drug or that drug, because the doctor, like you said, doesn't have but like 7 or 8, 10 minutes, and sometimes can get in that quick, just like, oh nope, this is what it is here. Especially if it's
Right.
been going around, right? If it's going around, everybody knows, oh, it's flu season. 8 out of the 10 people I see have the flu. Boom, write the script, boom, out the door. Boom, write the script, boom, out the door. It becomes very easy to be transactional like that, right?
For sure.
And so having the pharmacist that can look at the actuals, because not that you don't have time, things to do, but you're going to have more time to be able to sit and go, no, like this is a problem. We need to call your doctor. We still want to get you something. We want to get you the right thing.
Right. And I think a lot of people think like when they go to a pharmacy, they'll say, how long does it take to slap a label on something? Right. I mean, that's kind of like the general
Right.
consensus. And I kind
Yeah.
of want to dispel that myth is a lot of times there's maybe hundreds of scripts in there, right?
Yeah.
Number one.
Yeah.
Number two, you've got the pharmacist back there checking to make sure that everything on the prescription is written
Mhm.
correctly. Sometimes with electronic prescriptions now it's gotten a lot better,
Yeah.
but bad handwriting and things like that in the past
Yeah.
have made pharmacists call. Sometimes the dosage isn't right. Like they'll write something like if oh hey, give them 20 milligrams, but the tablet only comes in 15, so they might
Mhm.
have to call and make that adjustment because
Right.
I mean, these are all things that the pharmacist license is on the line now, right? And so
Right.
some things pharmacists can change depending on the class of medications and whatever,
Mhm.
but some they can't, and they have to get confirmation. And so their pharmacists are really there, and so that extra time is being spent making sure that the medication is correct,
Yeah.
that it isn't interacting with any of the other known medications that someone is taking, and that it's the right dose and appropriate utilization of the medication. So while yes, it could take 5 minutes to fill 30 pills, slap a label on the bottle and give it to you,
Right.
there's all these other in between safety concerns and metrics that are being put in place to make sure that when somebody leaves there, they're leaving there with the right medication. I've seen it before where they will fill a medication. And I mean, this happened with one of my grandparents where
Mhm.
we went to the pharmacy, they had a prescription, and the absolute wrong drug was put in the bag.
Oh, wow.
Right. And so had I not been there to look, and this is weird. This is nowhere near anything that they've been prescribed
Right.
to go. And I just took it back
Yeah.
and said, hey, this got filled wrong. Here's everything you get. And they have to dispense the right drug. But there's so many little things that can happen. And more times than not, that doesn't happen in a pharmacy.
Sure.
Right. Sometimes somebody just grabs the wrong bag or they put the whatever, however it works. 99% of the time that doesn't happen, but I've seen it, and that doesn't mean it won't happen again.
Right.
In some pharmacies, they have thousands of scripts a day that they see. I mean, there's a pharmacy near my office here in Tampa. I had a buddy that worked there, and they were doing 950 scripts a day, almost 1,000
Wow.
scripts a day. And it is full all the time. It's fully staffed, and they are running around like their hair is on fire every single day.
Yeah.
Because of how many prescriptions come through there. And the drive-through is around the block, and the line is, I mean, it is every single day. It's in a really busy part of Tampa, and it's where a lot of people converge. And there's a ton of doctors' offices around here. There's a hospital right down the street. I mean, there's a reason that it is so full.
Yeah.
So we have to take all these things into consideration. So when you get your medicine, if the tablet is a different color or it looks different, check and make sure. And sometimes it's just the same drug, same dose, just the manufacturer changed. One manufacturer has a white pill, one has a green pill. Happens a lot. But if you see something different or you don't know, don't hesitate to ask. I mean, it's your life on the line or your loved one's life on the line.
Yeah. Well, and when you talk about that, like, you know, being an baseball player and then baseball coach, like, obviously to be able to do that, there's a competitive piece of you.
For sure.
Right. And so, like, but getting into this, and I can see that competitive piece coming out in the advocacy side of things. Like you're wanting to make sure that people are, and so it's like, no, I'm going to keep going until the end. Right. Like that, like I'm going to keep until there's no outs left. I'm going to keep going. Right. But why is this so important to you to be able to advocate for people, to be able to help them?
So I will have to say, number one, first and foremost, I'm a huge proponent of quality of life. And I've seen so many people, they get to a certain point of their life and the quality is diminished for age or disability or whatever the case is. And I think that making sure that somebody is on the right medication, and making sure it's needed and the right dosing and right route and everything, and giving people the ability to spend more time with the people that they love and to do the things that they want. I mean, that's really the basis. That is life.
Yeah.
Right. And laying in bed 24 hours a day, 7 days a week is not a high quality of life.
Right.
And so giving people the opportunity to prevent getting to that point or to potentially get out of that point is really the reason why I do it. Is there's not a lot of people that are like, for whatever reason, I was like talking to a friend about this. I like being boots on the ground. I mean, that's just like who I am.
Yeah.
Somebody told me one day, hey man, you might get tired of this eventually, but I like being there. I like being in the trenches with people. It's just, I think I could probably find a bunch of different things that puts me in the trenches with people. But the healthcare system, people need advocates. They need communication, lines of communication. They need really, like, there's a lot of people that can help, or there's a lot of opportunity to help smooth out this crazy healthcare system that we're in.
Yeah.
But I just like watching people's outlook change and stop being so frustrated and adding just time to their life that's high quality so that, I've got a lot of clients that are older. I mean, most people kind of over the age of 50 is when they start taking medications, but I mean, I have some clients in their 80s and by working with me, they've been able to sometimes reduce their medications or get on a different medication that works better for them, or, even nutrition, a little bit of nutrition counseling and stuff. They're now able to spend time with their grandkids. I mean, they love their grandkids. And so I ask, what is your goal here? If you just want me to kind of take the stress of the healthcare system away, cool. But do you have some loved ones out there that you want to spend more time with, or that, and most of the time that's the case. They want more high quality time with their family and their friends and their loved ones. And it's really hard to watch, especially elderly people. They get to a certain point and a lot of their friends start dying, right?
Right.
I mean, this is like a
Yep.
fact.
Yep.
And so, my grandfather was like the last guy in his group of buddies. Like he fought in World War II. All of his buddies had already passed away.
Yeah.
He was the last one. My grandmother, last one between a lot of her friends and most of her family. I mean, she still has some family members around her age that kind of came up with her that are still
Mhm.
going, but you start to see these older folks where their circles start to shrink
Right.
and they start clinging on to what is left of it. And so being able to give them, instead of that clinging feeling, knowing that they're functional and that their families don't see them as a burden. I mean, that's kind of
Right.
something that happens too, and that they can still keep up. That's really what this is all about. And just maximizing their high quality time of
Yeah.
life.
Yeah. Well, and I mean, I love that. That's actually one of the reasons why I started doing what I do in helping people have more time with their grandkids. It's a huge goal of mine.
Mm-hmm.
And but when it comes to, we talked about this a little bit before we started recording, but like when it comes to people that are, whether it's family dynamics, like, or outliving everybody else type of, situation, like you talked about, um, or just their physical state in life, and they get into whether it's assisted living or the nursing home or, those types of situations. Like a lot of us think that, oh, well, now they have a 24/7 advocate that's there to take care of them. And most of the time, that's the farthest thing from the truth, right?
Right. 100%.
Like
I would say,
they're there to do a job and to care for them, to make sure that they're like quote unquote comfortable, but they're not exactly advocating for them to live their best life.
right. And I've seen a lot of times in this career is people will go into one of those facilities and they can be great, right? They can have a
Mhm.
sense of community. They can have things to do. Sometimes their family doesn't live in the same state or just can't, right? Like you've got
Mhm.
jobs and kids and,
Right.
other things going on. And so it's hard. It's really
Right.
difficult to kind of put all those pieces together. And so in some instances, like they're really fantastic. It gives people a sense of community. It gives them new
Right.
friends. It
Right.
gives them things to do and camaraderie. But on the other end of it, when you kind of see the dark side of it, you see people that are generally in pain with
Mhm.
other chronic illnesses or really dementia or Alzheimer's. And really, you can kind of see on the other end of it, on the dark side, you can really kind of see the decay of humans
Right.
as they age.
Yeah.
And the problem is like it becomes increasingly difficult for them to walk. They can become aggressive. I mean, especially with certain kinds of dementia.
Right.
And so then you look at the facility and I mean, they have to take care of their employees. I mean,
Mhm.
it can't be a dangerous workplace either.
Right.
And so it's sad because there's so many different factors
Mhm.
that play into it. And you'll kind of see the decline where you'll see people becoming over medicated and not having the care that they probably should because it's now a day to day
Right.
type of grind, or people dealing with cancer or chronic pain. They become heavily medicated and sedated. So when the family members do come see them, grandma's wiped out,
Yeah.
right? I mean, she's exhausted or she's just can't open her eyes to recognize because of the medications. And
Yeah.
really that's kind of initially that was the role of the consultant pharmacist. That's in some states have consultant pharmacists. Florida has one. I'm a licensed consultant pharmacist, where this isn't necessarily what I do, but they go and do medication reconciliations for these facilities.
Mhm.
They identify inappropriate prescriptions and prescribing, and they help patients get off it so that they can kind of not feel so debilitated by the medications.
Right.
And a lot of times it's really difficult to say what's right and what's wrong.
Mhm.
If someone is in extreme chronic pain and there isn't a lot of ways out of it, they might need the medication.
Yeah.
But if someone just had a few bad days and they got pissed off, they don't necessarily need that. But, now there's like the safety of the staff component, and there's
Right.
ways for them to kind of argue around the appropriateness of that prescribing. So you're anybody who's dealing with that is really walking a tightrope. And you can say everything that you want and they can execute it when you're there, but then when you leave, I mean, they're not the one there all the time. So sometimes these practices can go right back into their old ways. So there's a lot of ins and outs to it. It's not just an easy black and white decision. It's all gray for the most part.
Yeah.
But I think if someone does have a loved one in assisted living, call in, check on them, go visit them if they can, because they're a fall away from their life being changed.
Right.
They're a few issues away from really bad prognosis. So giving them that, or get them out of there for a little while and take them to the mall or take them shopping or to get some lunch with them. I mean, those are the type of things that kind of give people a little bit better of an outlook over time. And so I think it's difficult sometimes, but just that the few extra things to do for a family member or having a professional help with even spending time or, having that discussion can really kind of help people receive better care in those facilities, especially if the facility knows that someone's watching or someone's consistently coming around.
Right. Which again comes back to no, you're not necessarily being an advocate for yourself, but being an advocate for that loved one and helping them. And sometimes it is like, sometimes, and we've all been in situations like this where it's, I immediately think to like, I think something that's probably most of us have been through is like you get into a relationship with someone else and you're dating and it's great in so many ways, but the people on the outside in your group can tell like this isn't perfect. This is y'all don't need to be together, but you're in the thick of it and you don't see that. And it's not until you go out with the guys and then the guys are like, dude, let me tell you about her. Like, they wouldn't say that with her around, but as soon as you get outside of that environment, it's like, oh, let me tell you about this. And sometimes if our loved one is in one of those facilities and it's not the best, they're not going to tell you when you go see them in that facility.
Right.
You've got to get them outside the environment where they feel more comfortable. And it doesn't have to be back at your house. It can be, like you said, to the mall or to just somewhere where they can just relax and then finally go, okay, this is no longer a threatening area. Let me tell you what's really going on. And then you have to then look at it and weigh it and go like, okay, well, is this the disease talking? Is this reality? Is this something I need to follow up on? Whether it's yourself or getting somebody like you involved, it can go in and be like, hey, let me ask you some questions. What's really happening here?
Right. And I've noticed that in my case, when people get me involved, generally things have kind of deteriorated a little bit. But once I show up, they know, okay, there's a professional who I'm kind of like a certified reporter. So if I see something wrong, I have to report on it. Right. It's not like me going in. The average person can go in and maybe see some like elder abuse or something going on that they didn't like, and they can just kind of turn a blind eye. They go to grandma's room, check in on her. I cannot legally. I cannot. I can get in a lot of trouble if somebody find out I was there and didn't say anything.
Yeah.
So when someone with my credentials walks in, generally places like to tighten up because they're like, okay, I need to do the right thing and make it look like we're doing that. And I've had so many people that it, not necessarily even with facilities, but just if I go to doctor's appointments or I go to a treatment center or something, they'll say, man, just by you showing up, I got so much better care. And I didn't really do a whole lot. Just me being there, the license is standing there, right? Like I'm just a big walk-in license at that point.
Yeah.
But that will change because now the facility's like, oh crap, we could get in trouble. Yeah. And it sucks that it has to come to that. And there's plenty of things in life that are like that, right? Like once you have once someone's watching your back or something's going on, people kind of tighten up and it is what it is. But even if it's not a professional, even if it's another family member, you have more than one family member coming in and it's just, you never know when we might pop up.
Yeah. Then
they're always on their P's and Q's with that person. And it's really sad that it has to be that way. But there's, like a different conversation for a different day, like how many constraints there are on those facilities and on the system.
Right. So I know you've got a podcast and you help people along through this. So how can people like learn more information about what you're doing, whether they're willing to get into contact with you for help or just to get more information on like, okay, what if I need to find somebody in my area that can help me? I want to
Sure.
learn more about what Patrick does.
Sure. So my website is www.tampahealthadvocate.com.
Okay.
I have out-of-state clients, and like I kind of spacely sprockets in on their doctor's appointments. So they'll just bring
Right.
me on the phone, like a call like we're doing right now,
Okay.
and I can listen in and ask questions. So there's a virtual component of that.
Cool.
My podcast is actually called Men's Health Unscripted, and it's like really dedicated towards men more so than anything. And that was just because myself and my co-host Cam, he's a Marine. He went to
Hmm.
pharmacy school with me, and we just noticed that there's just a huge discrepancy in men's care and healthcare,
Yeah.
and then also men taking care of themselves. It's our responsibility too, right? Like it's
Right.
not just the
Yep.
healthcare system's responsibility to take care of us. So, but that's more about like just giving men an outlet and letting them know of different treatment modalities. We talk a lot about, I mean, the topics are across the board: depression, anxiety, mental
Right.
health. We've talked about aesthetics. We've talked about longevity, age
Mhm.
rejuvenation, testosterone, all those topics. And that's really just dedicated to men. I mean, that's
Yeah.
really a passion of both of ours. And Cam, being a Marine, he's seen a lot of mental health issues with his friends who he was served in combat with, and they came back to the U.S.
Right.
Um, we had a kind of feature on the local news here for Memorial Day last year, where Cam had deeply described, like, I went over to Afghanistan. We didn't lose anybody in combat. When we came home, I lost 6 of my friends, and
Oh, wow.
through suicide. And men die from suicide at a 4 times greater rate.
Mhm.
So these are topics that are really near and dear to our hearts as men,
Yeah.
and for our community. So I do like stuff is a little bit different. If you think of
Right.
me like a mullet as like a
Yeah.
haircut, right? Like being a health advocate is my business on the top, and
Yeah.
Men's Health Unscripted, the podcast, is like definitely my party
Yeah.
in the back.
Yeah.
But we both like deeply care about the men's health topic as well, and there is definitely some overlap there, right?
Yeah.
But
Yeah.
and we do talk a little bit about like guys advocacy in
Yeah.
healthcare and um, different avenues that goes.
Yeah.
That's a whole different conversation. But and then so you can find out a little bit more what I do on my website, which is
Yeah.
the tampahealthadvocate.com,
Awesome.
or you can just send me an email,
Okay.
Patrick, Patrick, at tampahealthadvocate.com. I check my email every day, multiple times a day. So I really respond within like 24 hours.
Mhm.
And if anybody just has any questions about their medications or anything, I always do a 1 hour free consult just to make sure that it's a good fit.
Awesome. Well, I greatly appreciate you being a guest.
For sure, Jerry.
Is there anything for somebody out there who is in that like that fit of person that you look at and you know you sort of see, maybe you overhear a conversation and you're like, oh my gosh, I could help this person a ton. Like for that person, is there anything that we didn't touch on that you would be like, okay, here is where you need to look, what you need to think, what you need to do, the question you need to ask, any of those things that we maybe didn't touch on that you would say like, here's your first step.
For sure. I think, the first step always for me, my training takes me to medication lists. So identifying the medications that you or a loved one, excuse me, has been prescribed, finding out how long they've been on. I mean, I've seen medication lists where somebody was prescribed something by 2 doctors ago, right? Like they've
Oh,
had two
wow.
doctors retire in the time, and that medication is no longer in favor. So,
Right.
making sure it's up to date. That's kind of where my training goes,
Yeah.
right? Do your research, and Dr. Google can be not the greatest, and maybe healthcare professionals don't really like hearing people say, well, I looked up on Google,
Right.
because Google can definitely be wrong too.
Yeah.
But just do general research. Like if you have a chronic disease or a couple chronic illnesses, you can definitely do research. There are some drug interaction websites that can generally be used. They're not always the best, but they can kind of give you a good idea if there's any
Mhm.
potential for any interactions.
Right.
But I mean, I have like a lot of the expensive like pharmacist databases here,
Right.
and those give you a lot more detail,
Yeah.
and you can kind of determine, because drugs that have interactions are used together all the time. I mean,
Yeah.
it's not like, oh no, stop it. Right. But it's just like there has to be more care put in. There has to be a lot more monitoring that goes into it to see if those two medications are a fit.
Right.
Genetically, people respond to medications a lot differently.
Yeah.
So, and that's like pharmacogenomics is another conversation for another day.
Yeah.
But understanding why someone's been prescribed something, that's super important, and showing up on time to doctor's appointments and just really trying to be more involved. It is tiring. It is extremely exhausting. I'm living it.
Yeah.
And I see like how I see how it impacts my patients, and I see how just kind of getting through a lot of this information impacts them as well. And then I would say something else that's really important that I've seen too is that make sure when someone's applying, like you or a loved one is applying for health insurance every year, so whether
Hmm.
it's Medicare or private insurance, make sure you know what drugs are on your formulary. If you're on a
Hmm.
certain medication, the formulary can switch year to year based on cost savings and manufacturers and everything.
Right.
So make sure that that's covered, because a big bill can come
Yeah.
here afterwards if somebody goes and gets a treatment and it was covered last year but not covered this year. So really being aware of all the things that are covered, which
Yeah.
outlets you have, and then also not being afraid to ask for a second opinion. So if the doctor says, hey, this is what I think it is, blah blah blah, and you maybe just don't feel right about it, like we've kind of been talking about this
Hmm.
episode, um, say, hey, is there somebody else I can ask about, or another test that we can kind of go over? And that might feel really daunting that you have to go see another doctor or get
Right.
another test, but again, it's your health, right?
Yeah.
And then that's at the end point is that's that more time with that, spouse,
Right.
grandparent, or grandkids, kids, things like that. So just in the moment, it kind of sucks, but think about long-term outlook on it. If you can catch something before you've been prescribed the wrong drug or been
Right.
given the wrong treatment, if you can catch it early,
Yeah.
go after it. And then the last thing I would have to say is if anyone that's kind of suffering with early stages of chronic disease, chances are it's reversible.
Yeah.
Um, if you've waited like 10 years, maybe not, because
Right.
then biochemistry things are kind of already out of line.
Yeah.
But if you get an early prognosis like pre-diabetes or type 1 hypertension, which is just like a little bit elevated blood pressure, try to
Mhm.
make those lifestyle changes, because they might put you on some medications for a while. They're a great tool and a
Right.
great resource to kind of put your body in a safe zone in order to be able to work off them. So
Right.
medications aren't necessarily always a life sentence.
Yeah.
And then finally, you or your loved one is not the disease that you were given. You are a
Ooh.
person, you are a whole person, and sometimes you might have to deal with that disease, but don't ever let anybody take that away from you, that you
Yeah.
are a person. And so um, I think holistic sometimes gets a bad rap in
Hmm.
medicine. It just means whole body,
Yeah.
right? It's not natural medicine necessarily or anything like that, but make sure you're being treated as a whole person
Right.
and not just a heart lying on a table
Yeah.
or an unhealthy, endocrine system or a
Mhm.
brain, right? Make sure you're being treated as a whole person in your healthcare.
Yeah. Well, and I love that because I think a lot of times the what can be more devastating from a or more detrimental in like a long-term health and how you live your life is not the diagnosis, but your reaction to the diagnosis.
Sure.
If you identify yourself as, a diabetic or that, and that's just who you are now, you're not a person who happens to have diabetes, then like, yeah, you've got to deal with it. You've got to, work through it and change your lifestyle and do all those things. But a lot of times announcing yourself as that, even if you're not doing it publicly, but you're doing it internally, can have far more detrimental effects than the actual disease can.
Absolutely. The way we talk to ourselves is, and I think most people check, this is kind of like a side note, but if you find yourself, and I'm guilty of this, if you find yourself talking to yourself in a way that if anybody else talked to you that way, you'd probably want to punch them in the face. Maybe it's time to stop, right?
Right.
Because we
Yep.
wouldn't let other people say the things about us that sometimes we say about ourselves.
Right.
And so flipping out of that mindset into a much
Yep.
more positive mindset and can alleviate stress, and it can really help with the healing process. I mean, our brains are
Yeah.
very, very powerful,
Yep.
and medicine is great, and everything, the technology that we have is fantastic. I mean, we have some of the most advanced treatments in the world, and that's really important to understand. But right here between the ears, you have a supercomputer basically
Right.
that is controlling your body and your thoughts. And I mean, you don't have to think about your heart beating; it just does it. And we
Right.
have really powerful machinery just
Yeah.
in this human body. So
Yep.
you know, it is a lot of times it is healable, but we have to change the perspective and the mindset that we are in about ourselves first.
Right. Perfect. Well, Patrick, I want to thank you so much for being a guest. It's been a great conversation.
Thank you, Jerry. It's been an honor to be here.
Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.